Victoria continues to experience an upsurge in syphilis. Primary healthcare practitioners play a key role in bringing syphilis under control and eliminating congenital syphilis. Make sexual health a routine of your everyday primary healthcare practice. As a GP and primary healthcare practitioner, please make sure you discuss sexual health with all sexually active patients and undertake regular, comprehensive sexual health screening in men who have sex with men, as well as heterosexual men and women.
Hi, my name is Jason and I'm a GP at Kings Park Medical Centre. I work in an outer suburban area of Melbourne. The dramatic rise of syphilis in outer suburban heterosexuals has changed the way I practice. Syphilis is known as a great imitator, and we should all be alert to the wide ranges of ways it can present, including generalised rash, visual changes and hearing loss. Given this dramatic rise, I recommend the routine antenatal screening at the first trimester, but also to test for syphilis and other STIs at 28 to 32 weeks and at delivery, given women are at higher risk. Fortunately, syphilis is easily diagnosed and treated. But for the more complicated cases, I recommend contacting the MSHC doctors on their GP support line, and you can also contact the GPs that are part of the Hub and Spoke program, and my GP clinic is also part of that. It can be awkward to talk about sexual health, but I'd rather do this than face the conversation about the tragic outcomes if congenital syphilis is missed. Sexual health is critical to the good health and well-being of all patients, so it needs to be included in everyday primary healthcare practice. With a little training, GPs and nurses can manage it well.
If syphilis is missed in a pregnant woman, the results may be disastrous for the baby. To avoid this from occurring, a syphilis test done preconceptually and at every trimester of pregnancy and at birth should be undertaken. Additionally, a syphilis test should be considered if the pregnant mother changes her partner, or if a current partner has other partners, or has signs and symptoms suggestive of syphilis. Congenital syphilis is entirely preventable, but our practice must be thorough enough to detect it. Sandy is 20 weeks pregnant and is attending a primary healthcare setting. Sandy presents to the clinic with a rash over her trunk, her neck, and the palms and soles of her feet. Hi, Sandy. Congratulations is in order. You and Greg must be so happy that you're having a baby soon.
Thank you, we're so excited. But I need to get rid of this rash that's on my body. It's all over and nothing, not Telfast or creams, is shifting it.
Oh, when did that start?
It came up on my back a week ago and now it's spreading all over.
Okay. Is it itchy? Does it keep you awake at night?
No, it doesn't itch, but I've been feeling very tired and just generally headachy.
Any high temperature or fever?
No, I don't think so, but since being pregnant I've been feeling tired and hot, so I can't tell the difference.
Okay. I might have to be a little bit more explicit and talk to you about your sexual activity. Is that okay with you?
Yeah, that's not a problem. You know everything about me and I've told you about lots of our sexual encounters in the past.
In the past you've mentioned that you and Greg have an open relationship. Is that still the same?
Yes, Greg and I are bisexual. He goes to saunas from time to time, not that often, and he only has oral sex. And then I also have my regular female partner, Linda. We've been together for years.
When was the last time you and Greg had any sexual activity?
Well, we've just mainly been having lots of close cuddling and some oral sex only, and the same with my other sexual partner, Linda.
Okay. And you said that Greg had a similar rash. Is that still the same?
Well, Greg, he doesn't like to get checked, and he's, even though you've appealed to him to have regular checks, he thought that maybe his acne was playing up, so he took some doxycycline as a short course.
Okay. All right. Let's have a look at the rash to see if it's sexually transmitted.
Okay.
It is important to invest some time in understanding the staging of syphilis, because if you get the staging right, then the treatment will be right too. The stages across syphilis are primary, secondary, and latent syphilis. You can see from this algorithm that the primary and secondary stages of syphilis are symptomatic. The latent phase is the asymptomatic phase, and it is only the syphilis serology that is reactive that alerts us to the diagnosis of syphilis. If the patient has had a previous serology in the last 2 years, the syphilis is classified as early latent syphilis. If the syphilis serology is more than 2 years old, then the stage is late latent syphilis. If there's no previous syphilis serology to compare, then the stage is syphilis of unknown duration. So very briefly, primary syphilis can present in many ways, but a painless chancre is the most common presentation, usually found on the penis, the rectum, the cervix, or inside the mouth, approximately 10 to 90 days after sexual contact. The average time is about 3 weeks, but the lesion may be missed because of its painless nature. So if you see a lesion like this, swab it to confirm the presence of Treponema pallidum, the organism that causes syphilis. Presumptive treatment for syphilis is usually appropriate too while you have the patient with you, because this current presentation suggests a high suspicion for a syphilis infection. Secondary syphilis is the great imitator, so it is often misdiagnosed as it presents in so many different ways that are easily mistaken for another condition. Here are a couple of examples to highlight some possibilities of how secondary syphilis may present. In the latent stage, we just have the serology to rely on for diagnosis, as there are no symptoms or signs to help guide us. It is critical to get the staging right. The stage of infection determines the correct treatment. We are lucky that benzathine penicillin treats syphilis effectively, but the exact treatment required varies according to the stage of infection. Primary, secondary, and early latent syphilis require a single dose of benzathine penicillin. That is 1.2 million units in each buttock, a total of 2.4 million units for the treatment. For late latent syphilis and syphilis of unknown duration, it's 1.2 million units in each buttock, a total of 2.5 million units for the treatment, but this is done weekly over 3 weeks for late syphilis. Syphilis is a bit tricky, but it's also quite fascinating and keeps us on our toes. Sandy, we've got to make sure that if this is secondary syphilis as the cause of your rash, we must diagnose this quickly, and if so, treat you urgently, because any delay may be harmful to the baby. The other causes of the rash could be pityriasis rosea or even psoriasis. So let's do a syphilis blood test today and include a full STI screen if you're agreeable.
Oh, yes, please. This is a precious pregnancy.
If your blood test comes back positive for syphilis, I can treat you, and then I'll let the obstetrician who's looking after you be aware so that the baby can be closely monitored throughout the pregnancy and when the baby is born.
Yes, I'd like for the midwife and the obstetrician to be aware if I have syphilis.
Greg will need to be tested too, and so will your regular female partner. So let's do this urgent blood test to see if you have syphilis in the first place. This video is only an introduction to syphilis. There are important details on staging, testing, treatment, and partner notification that have not been covered in this short introduction. I recommend you undertake the 90-minute advanced training module on this fascinating and important disease that every doctor and nurse needs to keep on a checklist of possible causes for many conditions that present in a clinic. So what to do next? First, you access the health pathways at the point of care. Health pathways outline the best practice treatment and management of syphilis. It has resources for patients and lists for local referral options. The Health Pathways website can be accessed via your local primary health care network. Second, get your practice trained in sexual health. VHITAL provides free foundation training in sexual health essentials and then a more advanced course on syphilis, HIV, and hepatitis. and this facilitates access to ongoing professional communities of practice. Your participation in these accredited activities will enable you to provide the best possible care through your day-to-day practice and help to get Victoria's syphilis and other STI epidemics under control.